Good afternoon, everyone, and welcome to this webinar from the Grantham Institute and the Centre for Environmental Policy at Imperial College London. My name is Neil Jennings, and I work in the policy team of the Grantham Institute, and I'm the lead author of a new report which we'll be discussing today called Delivering for Climate and Health: Insights from UK Decision Makers. And the link to that report will be in the chat shortly. So in terms of logistics, the session's being recorded and the slides and the recording will be shared afterwards. As we go through the session, please do use the Q&A function to post your questions and to upvote questions from other people who you'd like to be posed to the panelists later on. So just as I'm delighted to be sharing this report on behalf of the author team who are listed here, so Cvetina from the Grantham Institute and Ed, Nicole and Audrey from the Centre for Environmental Policy, all at Imperial College. You'll see on the screen the sort of running order for today's webinar. I'll start by providing an overview of the research and the recommendations that came out of it. After that, I'm delighted we'll be joined by a number of fantastic panelists. So Dr. Alice Bell from the Wellcome Trust will chair the panel session and the question and answer session. And we'll hear reflections from Cvetina Yocheva from the National Audit Office, Yogita Popat from Barnet Council, and Dr. Simon Opher MP, who's MP for Stroud. Without further ado, I'll provide an overview of the report. In terms of the context for this research, I'm sure many of you on the call are acutely aware that many of the actions required to tackle climate change also bring about simultaneous benefits for improving public health. And a recent report from the Tyndall Centre at University of East Anglia and the Grantham Institute at the London School of Economics highlighted these many synergies and links between things we need to do to tackle climate change and things to tackle or improve public health as well. And about this time last year, we spoke to one of the lead authors of this report to essentially identify where they perceive there to be existing research gaps, what their research hadn't been able to cover. And so our research then tries to fill some of those gaps, and I'll highlight on the next slide those specific questions. And one of the other areas they highlighted was they hadn't got as many people from central government departments, so that's another area that our research was trying to fill that gap on. So the research questions that we set out to try and better understand are listed here. So to understand better how the health-related benefits of climate-related actions are assessed and considered in a decision-making process, to understand whether those benefits make a difference to the overall decisions that get made, and to understand how things work in practice where the benefits of policies cross different departmental remits. And so to try and answer these questions, we conducted 23 interviews with people from central government, devolved nations, and combined and local authorities. The interviewees were typically quite senior, so in many cases director or deputy director level. Interviews last an average of an hour, took place between last December and this June, were transcribed and then thematically analysed. And in May and in June of this year, we shared back our insights and our interpretation of those interviews with some of the original interviewees, and we also presented and ran sort of discussions or took part in discussions with relevant groups as we get kind of outlined in the report, so at different levels, so health experts and local authorities, for example. And the report, if you want more information on the kind of approach that we took, it's all there in the report, including in the appendix. And the workshops and the presentations and discussions allowed us to essentially sense check whether our interpretation of the interviewees had been correct, and to amend our insights and our interpretation accordingly, to come up with 3 recommendations, which I'll highlight shortly. And worth mentioning that within the interviews, we considered climate-related policies in quite a broad sense, including those in housing and in transport, but ultimately those that have a substantive impact on reducing greenhouse gas emissions. And we were more focused on the mitigation side of stuff, although many conversations also covered the adaptation side of things as well. And so from those interviews, we arrived at 3 key recommendations, which I'll go through shortly. But just to kind of very briefly, I'll highlight some of the kind of cross-cutting findings which we highlight in the report as well, which are relevant to all the recommendations essentially. So that's around the siloed nature of departmental responsibilities and funding, of the existing tight fiscal situation at a whole variety of different scales, which we acknowledge can make a challenge for kind of more collaboration, and also that some of the things we are recommending do come with additional costs, and we recognise that kind of context in which these recommendations are sitting. But also one of the things that came out particularly from the workshops we conducted after the interviewees, was an acknowledgement of the fact that a number of the things which we are recommending aren't things that are necessarily unique to action on or incorporation of health and climate related policies. They also kind of exist as sort of more general recommendations which are relevant not just to climate change, but are particularly relevant to climate related actions, because there are so many synergies between things we need to do to tackle climate change and things that will also help to improve public health as well. So just to go through the 3 recommendations, the recommendation is around improving the monitoring and evaluation of existing and future policies to better capture health-related outcomes. And the importance of this recommendation came out particularly strongly in interviews that we conducted with decision makers from central government. And they often emphasise that the lack of high-quality causal data can make it harder to make the case to Treasury for the inclusion of certain health impacts in cost-benefit calculations for particular policies. And this recommendation of the need for more or better monitoring and evaluation resonates with previous recommendations from the National Audit Office at the national level and UK 100, who are an umbrella organisation for climate action at the local authority level as well. So these recommendations resonate with previous recommendations across different scales. And indeed, Cvetina, who will come after me from the National Audit Office, will elaborate on the importance of this shortly. And while we acknowledge the need for more causal evidence, we also emphasise that, as highlighted by the Lancet Pathfinder Commission, this should not come at the expense of timely policy action. Indeed, obviously, to develop such causal evidence, we actually need to be implementing policies in the first place to assess their outcomes. So in terms of other findings within this recommendation, from some of the discussions with departments, it was obvious that it was apparent that departments were acutely aware of the need to improve the quality of health-related impact data. So as an example, the Department of Energy Security and Net Zero was talking about their work trying to access hospital admissions data to assess the healthcare benefits of improving insulation of properties, so they could better quantify those outcomes. And we highlight on the screen some of the key bodies who are there already providing support for that health evidence. And one thing that was apparent, particularly at the local authority level, was that public health teams rarely have sort of analytical capacity. And so within each of the recommendations, we provide a case study of kind of like where things are going well. And the case study we include in this case is from the Public Health Intervention Responsive Studies team, which is a bit of a mouthful, but this is a program run by the National Institute for Health and Care Research, and their sort of public health researchers from different universities are supporting local authorities to help them develop the kind of evidence base for their interventions, essentially. And when considering the challenges of implementing this recommendation, inevitably to do more monitoring and evaluation comes with consequences in terms of time and money and expertise. And that's why the example that we've given out, the case study of the Public Health Intervention Responsive Studies team, is kind of a nice example of where these things are trying to be bridged to support local authorities to get hold of this data that's relevant to their specific locality. Okay, so the second of the recommendations we had is around implementing policy frameworks that integrate health in climate-related decision-making and supporting collaboration and coordination between departments. So this recognises the fact that, as highlighted by the Scotland's recent population health framework, that as much as 80% of what affects health outcomes is shaped by factors outside of the health and social care system. So emphasising that real importance of collaboration and coordination to help to achieve positive health outcomes by engaging with other non-health departments. And we identified a range of approaches that were already out there to integrating health in the decision-making process across the UK. Notable examples are the Welsh Wellbeing of Future Generations Act. This we perceive to be the most formal approach. So indeed, it's a law which mandates the consideration of health as one of 7 long-term goals that public bodies in Wales must consider. And indeed, from next year, from 2026, health impact assessments will be mandated in circumstances where public bodies are making decisions of a strategic nature. The Future Generations Act in Wales is an example of a health in all policies approach, and this kind of approach is also present in Scotland, which has got a long-standing focus on reducing health inequalities, and also in some local authorities, although in a less formal way, as you probably would expect. Up in Scotland, it's worth mentioning the Scottish Government have recently published their population health framework. So this is a collaboration alongside the COSLA, who are the Convention of Scottish Local Authorities. And we think this is a really nice example of the kind of integration and collaboration at different levels of government. So the fact that this is coming from the Scottish Government with local authorities, and that they co-sponsor Public Health Scotland to provide that kind of practical support to integrate health in health-related evidence and decision-making. We think this is a really nice example of how things are joined up across scales. Well, one thing that came out from our workshop was just the need to, see, there are different approaches to integrating health in decision-making at different scales of government across the UK. And we probably do need in the future comparative approaches to understand ultimately which of these different approaches is achieving the best outcomes, and how that might, one thing that works at one scale may not necessarily be what works best at another scale. In England, the Treasury's Green Book is a kind of key thing that provides guidance for how health is considered in non-health policies, and the Healthy Places team, which is part of the Office of Health Improvement and Disparities, which is in turn part of the Department of Health and Social Care. That is a team who are practically helping to support non-health departments to integrate health impacts of their policies. So the strong impression we got from a variety of different levels of government was of the kind of increasing appetite from non-health departments to consider the health impacts of their policies. So we see that as being a positive thing. In England, it seems this has been catalysed recently by a number of things, including the government's health mission, the Lord Darcy review into the state of the NHS, which really emphasised the importance of health prevention, and the new NHS 10-year plan, all focusing on the need to focus more on prevention rather than just treatment. We perceive these changes to set a kind of a positive framing of a positive situation, but we also think there is more momentum that could be built on. So specifically, we kind of see the opportunities for further sort of cross-departmental collaboration. And last year, the Health Foundation noted in one of their reports that when the Office of Health Improvement and Disparities was set up in 2021, when it was broken out from part of Public Health England, the intention was that would be accompanied by the creation of a new cross-ministerial board on prevention, which would kind of lead and help to coordinate action across government. So you'd then have ministers from housing or from transport feeding into health prevention policies much more directly. So that intention never came to fruition, partly because of the Truss administration and the Sunak administration and the fact they were less focused on public health. But we suggest, given the health mission, given the Darcy review, given the new NHS 10-year plan, this may well be an ideal opportunity to revisit that original intention for the Office of Health Improvement and Disparities to kind of get that cross-departmental collaboration. In the report, we highlight a range of examples of initiatives or approaches that are already supporting cross-departmental collaboration that benefit climate and health. One of these listed here is the Treasury's Shared Outcomes Fund, which is a programme which incentivises departments to work collaboratively on areas such as net zero. And they have, for example, funded the Healthy Homes project, which is a really nice project with Department of Health and Social Care, Department of Energy Security and Net Zero, and the Ministry of Housing and Communities and Local Governments, bringing together three key departments to get more action on healthy homes. An unsurprising finding from our research was that kind of cross-departmental collaboration was easier at local level, on a practical level, because people are more likely to be based in the same office. And I think a really nice example, the case study we provide for this recommendation is from Hammersmith and Fulham Council. So in this case, the climate team of the council wanted to set up a project called Beat the Streets, which was all about encouraging more active travel. The climate team didn't have a budget to get this set up, so they approached the public health team of the council, who, because of the health benefits of this climate-related policy or action, they then contributed over half of the budget to get this project off the ground, which then saw the participation of 13,000 members of the public who walked, cycled and wheeled over 95,000 miles in 6 weeks. So worth emphasising here, that project simply wouldn't have happened without the collaboration of the climate and the health team in that instance, and the sharing of budgets in that case as well. Because the barriers to implementation of this recommendation, one of the key things is the need, and this came out strongly from the workshops, the need for senior level buy-in to set the tone essentially for that collaboration between departments and get the right structures in place to necessitate or to support collaboration. The third of our recommendations was around building awareness and raising the salience of the health benefits of climate action amongst political leaders. This links closely with the previous point I just made around getting senior level buy-in in order to develop those collaborative relationships between departments. And it reflects the importance of having leaders who can understand and articulate the health benefits of climate action and the associated benefits that can bring to reducing inequality and helping to reduce costs for the health service. And as an example of this, and one of the things that came out of one of the workshops was a discussion of the need for health ministers, secretaries of state from the Department of Health and Social Care to be more vocal about the role that climate policies can play in helping to deliver health benefits and reduce costs for the health service. When considering the practicalities of how to build this awareness, interviewees spoke about the need to package up qualitative and quantitative insights together to provide real-world, memorable stories that resonate emotionally with decision makers, coupled and backed up with, linking back to recommendation one, the kind of stats that can then feed into those cost-benefit analyses. In terms of the challenges for delivering this, we are aware, obviously, the pushback that some parties have had recently against net zero, which can reduce the willingness of some individuals to talk about climate change. But ultimately, we suggest this helps to make the case even stronger for talking about the health benefits of climate-related action because they do resonate much more consistently across the political spectrum. And lastly, and just to conclude, those are the three recommendations. Ultimately, we did find examples of things moving in a positive direction in terms of the greater appreciation and consideration of health-related benefits and impacts in climate-related policies. This can help to build the case for more climate action, but we do highlight areas relating to those recommendations about where more action is still required. And ultimately, getting this right can help to people to live longer, healthier lives, to use public funds more efficiently, and also to help to reduce greenhouse gas emissions at the same time. Thank you very much. I'll hand over to Alice. I hope you enjoy reading the report.
Thank you so much, Neil. It was so good to hear a run through again of that report and hear examples of some bits of work which I remember happening around work that I was doing when I was focused on UK climate action. It's one of the reasons I took the role at Wellcome to be focusing on climate and health, because I, like many of you, had seen the huge power that bringing health into the climate space can bring. So we're now going to have three expert speakers that are going to reflect on some of these recommendations. And firstly, we have Cvetina Yocheva from the National Audit Office, and she's going to be looking at the first of those recommendations on improving monitoring and evaluation of existing and future policies to better capture the health-related outcomes. It's something that I certainly spend a lot of time talking about. So over to you at the National Audit Office.
Thank you, Alice. Hi, everyone. I am Cvetina. I recently joined the National Audit Office in their value for money transport team. And yes, I mean, this recommendation on improving monitoring evaluation resonates very much with the work that we have been doing in NAO and across different policy areas. But it also resonates with my personal experience as a champion of monitoring and evaluation and evidence-based policies across government departments in the UK and other organizations. In NAO, we see monitoring and evaluation as a shortcut to value for money and efficiency. And why? Because when you have good baseline data, you're able to design your project in a way that you target the right beneficiaries, you design the right interventions. When you use timely data from monitoring and evaluation, you're able to pivot your activities and drop what's not working. This keeps you on track and you're able to deliver. And finally, when you know what works and what doesn't work, you are able to make the case, make a compelling case, and get more funding to ultimately support the interventions that are working and drop the ones that are less effective. So ultimately, I see monitoring as evaluation, and I hope that decision makers and policy makers see this as a tool to inform their decision making and to make allocative choices, to know what policies and programs need to stop because they're not working, what needs to be amended in a way that it could deliver better value for money, for taxpayers' money, and what needs to continue the way it is, because as you mentioned, there's a lot of good examples, good practice examples. We need to capitalize on those. And I'll just give, I said that there are quite a few examples from NAO work, but I'll just give you one example from a piece of work that my team did a couple of years ago on Active Travel England. So NAO audited Active Travel England in 2003 and found that at the time, neither the Department for Transport nor the agency, Active Travel England, had a plan to track the benefits realized from their policies. And most of those benefits were around public health, improving the environment, economy, etc. So there was no metrics identified to track this, the delivery of these outcomes. And NAO had a similar recommendation as yours to improve the monitoring of outcomes and over time. So one thing about NAO reports is that we always follow up on our recommendations, even if it's a year later or a few years. Every year we follow up on our recommendations. And so I was very pleased to see that there is progress in this one. Active Travel England has commissioned a review of common metrics, and as part of their portfolio evaluation, they have developed a theory of change which help them identify the right metrics of what they need to measure. I'm also very pleased to see that this summer, Department for Transport has published detailed guidance for local authorities on how to measure, how to track the results from their active travel interventions. And actually, it's exactly what you expect, right? You want to see, and this is in NAO, this is what we are hoping to see across government. When you have clear metrics, when you have a good idea of what good looks like, and when you give good guidance with specific reporting requirements of what needs to be collected, I think you have a better chance to collect this data that you were mentioning, to understand what type of data needs to be collected. So I think in this example, we still have to see how local authorities are reporting and whether they're using this guidance. But I think this is the first good step, and it's good to see this. And finally, I wanted to bring some reflection from the work I've done here and my previous work in government. I've seen there is a risk of seeing monitoring evaluation as a burden, and I've heard a lot of excuses over the years. Oh, it's too expensive. Oh, it takes a lot of time to track the impacts. It takes a lot of skills and resource we don't have. And I think that it is possible, but to do this, you need to have at least 3 things. And the first thing is, Neil already mentioned, you need the senior buy-in. You need decision makers to agree that we need to be able to try and prioritize this. You need to have good resource, analytical resource, to make sure that you have, you bring the analytical, whether it's consultancy, whether it's internal, ideally internal analytical resource. And then the third one is collaboration, which was already mentioned as well. But I have seen a lot of working in silos, and you've picked up on your report, rightly so. There's a lot of working in silos across across government departments, across different professions. For example, monitoring evaluation, there's a lot of overlap with benefits realization on the monitoring side, and yet different sets of guidance, different communities, somehow different skill sets. So I think working across collaboratively, across professions, bringing different specialists is something that can help a lot. And I will leave you with, I'll just share in the chat a tool that NAO have published a couple of years ago, which I find very comprehensive. And it is about how you can embed monitoring evaluation through your programming cycle, regardless whether you're working in a local authority or central government department or an NGO. Thank you.
Thank you so much, with a really wonderful live working example from Active Travel, and taking us to kind of bridging us to our next topic of thinking about collaboration with your last point. So we're going to go from the National Audit Office to local government and to Barnet, and Yogita Popat, who's Programme Director for Strategy, Culture and Sustainability at Barnet Council, and she's going to reflect on the second of those recommendations, which is implementing policy frameworks that integrate health and climate-related decision-making and support the collaboration and coordination between departments to help us get over those silos. Over to you in Barnet.
Thanks, Alice. I'm going to sort of build on what my colleague was just talking about around that collaboration. So at Barnet, we really recognise that, you know, work is already happening, and it's not about starting things new or adding burdens to what people are already doing. So, for example, our colleagues in our green spaces and leisure teams are already working on active travel, but they're working on it through a lens of health and well-being. So really thinking about the work that is already happening and using that to be the catalyst for delivering our climate goals. So when we set up our programme locally, we sort of started at that point of actually what is already going on across the council, and how do we bring those people together to collaborate, to break down those silos, to actually deliver a shared outcome. And also recognising that if we don't break down those silos and we don't start working together, you have a real risk of sort of impacting negatively on some of the things you're trying to do. So, for example, if we're about to build a brand new motorway across the borough, which we're not, but if you were to build a brand new motorway through the borough, it's actually having a negative impact on your air pollution, for example. So by having those conversations together, we were trying to join up and sort of also thinking about, hold on, we're about to maintain our new vehicles. We've got a new fleet coming in. Our vehicles are at end of life. So do we actually change them to EV vehicles now, or do we wait 3 or 4 years and do it in a real systemic way? And some of the things we've talked about today is about money and actually funding some of this stuff. So actually thinking about funding in the right ways at the right time for the right people. So if I give you a real example, because, you know, I have been asked to give a real example. So our work on climate adaptation, for example, is a joint effort between public health, emergency planning and the sustainability team. So over the summer, public health were doing a piece of work around the impact of heat on vulnerable residents. So what we were able to do is that in the sustainability team, sort of like jump on the back of that piece of work, but also think about cool spaces. And while we were talking to communities about cool spaces, our emergency planning team was having those conversations as well, so for emergency situations. So actually what that then did was it was a collaborative piece of work where we all worked on it together, but also that opens up a lot more funding. So you're not getting funding just for climate goals, you're doing it for emergency planning and health. And it's also about engaging and feeding into policies and plans at a very early stage. So our plan for Barnet is very much about caring for people, our places and the planet. So it interlinks all of that through. So all of our strategies and policies have that golden thread throughout it. And then very quickly, and there is a bit of a challenge about putting pounds to pence and the long-term impacts. Really hard to kind of measure, if you're sorting out air pollution today, the impact on the long term. But actually what we need to be thinking about is the cost of inaction and what is the counterfactual of not doing things. And most importantly, the last thing I'm going to sort of focus on is there's more and more recognition of the benefits of changing our narrative. So we used to talk about retrofitting homes has a co-benefit on damp and mold. But actually, if we flip that round to what people can resonate, if you have a warmer home, a safer home that hasn't got damp and mold, the co-benefit of that is reduction in climate emissions. So let's start flipping that narrative so it becomes real to our residents and the people that we're working with. I'm going to stop there because I think I've run out of time.
That was beautiful. Thank you. I love the idea of flipping back and forth on the co-benefits. It's often we take one rather than the other. And if we're really thinking about it, we think about starting from what people care about. We're going to go from Northwest London to the west of England, and from local government to an MP, thinking about what happens in Westminster. And it's really great that we've got Dr. Simon Opher, MP, who was a GP for 30 years before becoming the Labour MP for Stroud. And he's a great person to speak on this topic because he's currently chair of the Health All-Party Parliamentary Group, and he's vice chair of the Climate All-Party Parliamentary Group. And we'd really like Simon to reflect on the second and third of those recommendations. So again, thinking about the cross-departmental collaboration within government, but also how to raise more awareness of the health benefits of climate action amongst political leaders. Over to you, Simon.
Thank you very much. And as you say, I'm really a GP, and I've been an MP for about a year, so I'm just learning the ropes there. But so one of the things I've really noticed about being a politician is that actually everything is linked together, and so you can't. So I think there's a naturalist called John Muir who said, when we try and pick out anything by itself, we find it's hitched to everything else in the universe. So that's a way of understanding how health and how climate works. So nothing is allowed to be siloed. And I think one of the good things about our government is we look at a more of a mission-based approach. So that means trying to work across different departments. Now, whether it's been really successful, it's difficult to know because there is still siloed thinking, and I have to admit that. But that at least has a policy of trying to work together, and there is there's loads of connections. And if we look at all these things, climate, food, and then things like green spaces. Indeed, so. Well, I've been really keen on getting access for people to green spaces so that they can improve their health, and that's been my main passion over the last 27 years as a GP, is about using nature and the arts actually, but specifically nature in this context and active travel to make people better. So I would prefer people cycling into work than going to the gym on the way back from work, because that tends to both help the climate, but it also helps their own fitness as well. So they're the sort of types of things that I think we need to think about. And I also did some work with gardening on prescription. So instead of giving people a medicine, and medicines are actually fairly climate damaging and carbon intensive, if we can use different strategies to treat people, that can really, really help as well. And someone put in the chat just now about meat. And I think that's a really, really big issue because it drives, agriculture in general drives about 30% of our carbon emissions. And that's predominantly meat, actually, which is the main problem. So we need to, both from a health point of view and a climate point of view, eat less meat. So I'm not suggesting we all go vegan necessarily. You can, it's great if you want to, but I do think as a nation, if we all ate half the amount of meat, our health would improve and the climate would improve. So you can see how everything is sort of linked together. And then active transport, as previous speakers have been going about, is incredibly important. So we need to get children cycling to school instead of dropping them off at the gate and having a massive traffic jam. What we need to do is getting them to cycle to school, and that again has benefits all over the place. So it actually benefits communities because people tend to talk to each other more when they're cycling, but it also improves the climate. It also improves pollution, and it also improves their health. So we need to look at innovative ways of getting young people to start using more active travel, and that obviously has implications for air quality, etc. as well. And one of my roles is that I've now become the Climate and Nature chair of the Climate and Nature Caucus, which is looking at both climate and nature and how they interact and how we can improve it. And as I said, everything is linked together, but certainly climate and nature is very strongly linked together. As opposed, coming on to housing a little bit, so that whole thing about warm home discounts and home insulation is incredibly important, and we're investing quite a lot of money into that. Again, that's going to make people healthier. So there's something like if you drop your temperature in your house by 1 degree, your blood pressure goes up by on average 3 millimeters of mercury. So just being warm is actually quite good for you. But on the other hand, we can't just pump heat in houses, we must insulate them. So I don't want to go on, but the other thing I'd like to say is someone was saying about national and local and how it sits. And I do feel that this type of thing, I mean, big climate issues have to be national, but actually how we all work together has to also be, it has to be national to a degree, and we have to know what we're doing and we have to share those decisions. But it really comes down to local stuff. So I used to chair the Stroud NHS locality, and we had housing on there. We had some from the council who talked about buses and active travel. And so we have to get these groups all together, because actually health is not based on doctors, it's based on all the other determinants of health. And as soon as we realise that, then we will get political gain. One thing I would caution, and this is my last point, I promise, Alice, one thing I would caution is that prevention, and one of the main NHS strategies is go from cure to prevention, and that's what this is all about, in my opinion. But prevention is very difficult to measure, because you're basically trying to measure something that doesn't happen. So what I would say is we need to be aware of what we're trying to do and measure it in a sensible way. But often we don't really know, we can't measure exactly what our interventions are. So we have to look on a massive and long-term scale to see what's happening. So I would just caution a little bit about if we're relying on preventative data going down, it's going to be difficult. It can be measured, but it's quite difficult to. So yeah, thank you, Alice, and I'm very happy to answer questions.
Thank you so much. We've got some people. Sorry. Oh, I've got it. Okay, there we go. I know we've already got some questions in the chat, and I really would invite people to add more. I thought, because Simon ended his remarks on a point that has actually already started to come up in one of the questions on measuring things that have been prevented. I wondered if either of the other panelists had anything that you'd like to add on that question of measuring what could be a counterfactual, for example. Yeah, go ahead, Yogita, go ahead.
Yeah, thanks, Alice. So I've sort of responded in the chat as well. That's really hard. So one of the things we've looked at is around insurance claims. So for example, if there is a road that consistently gets flooded, which has an impact, and we have to go in and do some maintenance on that road, or stop, get rid of the water, it's thinking about those. But in terms of the health impacts, that's much, much harder. And I think someone's put in the chat, like, if you've got it right, you won't have a health impact. So that is that counterfactual question, isn't it? And I've sort of put in the chat, if there's any academics out there that want to do this research, everyone's shouting about it, because trying to put pounds and pence to what we are doing is really, really hard work. And quite often, to get funding, you need to show a bit of a return on investment, and you can't always show that. How do you show a return on investment? By having a warmer home, because people are warmer and therefore their mental health is better, their blood pressure is lower, etc., etc. Because that doesn't equate to pounds and pence. But if we could say, for every pound you invest in this, it's got a £32 or a £40 health benefit, all of a sudden the conversation becomes a lot more palatable for those people investing in climate.
Yeah, thank you. And I'm sure there are some academics on the line, but also I'd say, as the representative and academic research funder, I have also noted your enthusiasm on that point. Cvetina, do you want to also say something to that?
I just wanted to add, and I completely agree with what Simon said, that to measure health benefits or even prevention, it's very hard, because you have multiple factors that contribute to an outcome, and it's very hard to disentangle exactly the attribution to a specific policy or measure. But I think it is important to take a step back and to connect the different sources of data, and this is where it is really important to work with researchers to conduct evaluations, even over longer term studies, and maybe take even comparative approach. doing trials with, in some cases, when it comes to health, it is not ethical to do counterfactual and let some populations benefit from, and have others, a control group that doesn't. But I think there are other methods that can help here, and looking at different sources of data, looking at changes over time, looking at connecting local data in certain municipalities or cities with transport data, with even with mobile phone data. There's a lot we can already track from our phones. So I think we need to be creative, but there's also the point that it has to be proportionate. And I think, Simon and Yogita, you mentioned this, it has to be practical and pragmatic. If you have enough evidence that living closer to a green spaces obviously has health benefits, for a local authority, probably you don't need to measure that. You need to be pragmatic and see what is realistic within the resources that you have, what is realistic to measure, and within the funding. And I think this is where I wanted to make the point about bringing analytical advice early when you design the policies, because this can help. You could have a monitoring and evaluation arrangement that is very proportionate, regardless whether you have a small program or a big program. You could still find the right size for your intervention that will give you some proportionate arrangements and ideas of how you can track what you can do to track impact over time. Thank you.
Thank you. We got a question from the chat, noting that a lot of the discussion has been around, and generally a lot of the conversations and measurements around the climate and health space has been on the co-benefits to physical health, and whether anyone had any comments to make about mental health. I know that Simon did touch on a bit of that, but it's something maybe we could bring out both as a question on measurement, but also more broadly. Neil put his hand up first. I'll go to
yeah, I'll just mention it because at Imperial we have a program called Climate Cares, which is focused on the links between climate change and mental health. And I think Lucy's question there is a really good one, and is an area which a lot of people are conscious of at the moment. So Lancet Pathfinder Commission have highlighted this as being an area where we do need metrics on this in order to be able to essentially monitor what changes are taking place. So for those not kind of familiar with these impacts, as an example, when there was a heat dome in British Columbia in Canada back in 2021, temperatures were 49 degrees, and during that period of time, 8% of people who died had schizophrenia, compared to less than 1% of the population who live with schizophrenia. That's kind of an example of these impacts. So yeah, I mean, I guess the mental health metrics are not there at the moment. They need to be, and that's something which a lot of organisations, including Wellcome, are, I think, very conscious of.
Yeah, Simon as well.
No, just very briefly, I think a lot of particularly natural impacts are very, very important for mental health, and indeed all that active travel stuff is really transformative for mental health as well. So getting people to do more exercise and then doing stuff in nature, growing their own food, etc., and having access to nature and swimming, etc., is all being proven to be incredibly effective. So we did a big study on green social prescribing, for example, which was it has got really well. It's got about as much benefit as going on an antidepressant. So that's pretty impressive, I think, in that way. So thank you.
Yeah, and it's doing studies like that which allow us to help have better measurements on that. And I represent Wellcome's climate team, but we sit alongside a mental health team. We have done, as Neil mentioned, we have been investing in some cross-program work, particularly on heat. So I hope that us and several others that are really interested in increasing the research out there will mean that it's easier to measure these things in the future. Moving to Cvetina, did you want to speak on mental health? Go ahead. I can.
Just to add that there is a pretty big piece of research that was done in the UK over 8 years of research that showed that there is a strong link between walking in the morning and improving benefits for mental health, reducing depression and anxiety. So yes, I think there's plenty of evidence. The question is, what for me, it's interesting to know how can we measure realistically, and you know, what data could be taken at local level to do that. Thank you.
Yeah, and also making use of the evidence that we have and it being politically salient enough to be pulled through. Yogita, do you also want to?
Yeah, I was just going to come in on like a real life example. So locally, we introduced community skits, and the primary reason we did that was around reducing fly tipping in the borough. But what we've now done is we've introduced community skits that pop up across the borough throughout the month, and they're in different parts of the borough. And what we found very quickly was that neighbours started talking to each other. So we had those people who might have been struggling with social isolation, never having met their neighbours, and all of a sudden they've gone to the community skip and they've met Mr. Smith from next door or Mrs. Brown from the door down the road. And all of a sudden you're making these, connections. What we also found by producing that piece of work, and it goes back to that unknown impact in other area and dependencies and things. What we also found was that many people were throwing away bikes, for example. So what we did was we gave those bikes second chances. We took them out the skits, we rebuilt them, we fixed them. So we're stopping things going to landfill. So we're reducing like our landfill. And what we were then able to do is take those bikes and give them to the vulnerable young people in our borough. So all of a sudden, by doing a very small initiative, which was about fly tipping, we've had impacts on like mental health through social isolation, but also what we've done is we've reduced our impact on landfill as well and supported vulnerable people, like multiple benefits, but not once did we talk about climate in that, but it was an impact.
Oh, that's a lovely example, and a lovely example of joined up policymaking as well. It's reminding me a bit of some of the research on cooling centres in Greece when there were heat waves, and how not only did that just give people respite from the heat, it was a place where communities come together and build that social capital, which is important for people's mental health, but also as a way of it's a resilience strategy in itself to have better connections with your neighbours. Knowing your neighbours if there's a flood is really important. Simon, did you have another thing on mental health, or I can move on to the next question?
Well, slightly on mental health, and it's slightly on one of the comments about, there was something about meat and meat consumption as well. And I'll just a more general point. So that, mental health and climate and general health and nation, we have to be brave as politicians to bring about real change. So I would give the example of ULEZ. So ULEZ, when it came in, was pretty unpopular, to be honest. But actually, if you look at asthma data, that really has improved over time. Same with smoking in pubs. People didn't think it would work. So those sort of brave political decisions are really important. And I think we do need to look very seriously at a government-wide, some sort of measures that will make meat consumption less, rather than just relying on individuals. So I totally agree with you, Matt, on the chat. So.
Thank you. I'm going to move us on to a slightly different question that's come in about noting that no one's really mentioned the private sector yet. And though I think this is an area which, many different policymakers at local, national, regional level will be partnering with private sector, and also this a key stakeholder. Does anybody have any comments about thinking about either market-based measures or work where there's been collaborative work between different governments and private sector, or thinking about incentivising climate and health outcomes, which would also generate growth? Anyone got any thoughts on that?
Shall I come in there, Alice? So
you go, and then Neil will also offer something.
Oh, sorry, I forgot. I didn't put my hand up. Very bad. So actually, I think there is something that we're constantly doing. We are absolutely working with the private sector to sort of think about how we bring investment into the work we're doing, not specifically around health, but actually there are those conversations happening. Again, it goes back to that return on investment, because if you're making someone's house warm, the impact is on that person's home, not those private investors. So there is more to do in that space, but conversations are happening and investors want to have those conversations with us. I'll hand over to Neil.
Yeah, Neil, did you have something you wanted
to
add?
I have to admit, I don't have a huge amount to say other than just So I suppose we're thinking of what's there already in terms of the way in which individual companies are reporting on risk. So obviously this task force for climate-related financial disclosure is an example of companies reporting on their risk. Right, there's a degree to which that risk extends to the risk for their workforce, in many cases associated with health-related impacts, as that kind of metric is already there. There's a different example, it's not specific to private sector, but one I want to mention is the work that the Global Health Alliance on Climate and Health are doing at the moment, where they're engaging with individual countries around the degree to which health can be considered and incorporated in the nationally determined contributions that individual countries are putting forward. And so you kind of wonder the degree to which health can be potentially more integrated within climate-related projections and targets that are being set from individual countries, both to emphasise their kind of vulnerability in some cases, but also to emphasise how these actions can be better aligned. And that can itself be a motivator for encouraging businesses in those countries to be reporting more directly themselves on those interrelations.
Yeah, thanks, Neil. And I think, NDC, these nationally determined contributions, these national climate plans are many of them have already been developed or being submitted at the moment. And then we'll also be having to move that conversation on to how we implement them. And that there will be lots of opportunities for climate health to come up as a topic for thinking about how public and private groups work together. Simon,
just very briefly, I'm sure most of you are aware of this, but there's a business sort of setup called B Corp, which prioritises people and their mental and physical health, and it also priorities climate and how we shouldn't damage climate. So we should look after people and look after the climate. So that's a great example of private companies, and in general, those companies make more profits, interestingly. So it's a great model in that way.
Thank you. And I've got another question on thinking about addressing both climate and health misinformation. And I wondered, because I think that's something where we see discussions of both climate misinformation and health misinformation. But I certainly know from talking to people who work around the world that they're increasingly seeing issues where it comes in the intersection. And I wondered if anyone had any reflections they wanted to share on that. I appreciate it could be something that's quite a difficult topic, but anyone got any thoughts on that? Neil, go ahead.
I mean, I think it was a few weeks ago that Climate Outreach published their report on Britain Talks Climate and Nature, which is a fantastic resource, which I'm sure many people on the call have come across. And so they talk about this as being a kind of an issue and a challenge. I don't necessarily, and I guess a key thing of this comes down to who people trust in terms of where they go to get their information as well. And I guess one of the key things there is that typically scientists are very highly trusted, but doctors and nurses, health practitioners, are amongst nurses, particularly amongst the kind of most trusted people out there. As I suppose it's a key question and a key aspect for messages around this to be coming from those people because they are trusted. But I guess the disinformation side of stuff is a kind of a slightly different thing, isn't it? And within the Climate Outreach report, they highlight this group of people who are getting their information from sources which, frankly, are spreading lies around both issues. I've waffled on actually. I haven't answered the question. I'm going to hand over to Simon.
Yeah, no, well, I think it's really difficult. And this misinformation is incredibly common at the moment, with and the social media sort of structure allows it to come on. And I think that, but actually, if you look at a lot of the data, most people are concerned about climate and realise that net zero type policies are really relevant and really good for their kids. So the majority of people are, and with health, you get all sorts of weird stuff about health always, and lots of people have all sorts of conspiracy theories. But generally, I think the NHS needs to be got on board because of people trust the NHS, and as you say, they trust nurses. They used to trust doctors. I think they do a bit in that way. But if we can stress the benefits of cycling, for example, as well as central government giving us money to make cycle paths, then we've got a perfect sort of union between those. But yeah, disinformation is a massive problem in politics and in life, isn't it? And we just have to keep on banging away, I think.
Thank you. I'd also add, as health spokespeople, people with lived experience of health conditions. I think we've seen that with some of the air pollution questions, people who live with asthma and lung conditions. And I think increasingly we're seeing it in terms of the mental health question, having people who are living with mental health conditions that are affected by heat, for example. But across the board, there's so many different ways in which people know it affects their own lives. And when we're worried about elite spokespeople that sometimes aren't trusted so much, they can be really powerful in lots of places and should be used. And we shouldn't we shouldn't be cautious of using them, but I think it's sometimes forgotten are patient groups, which are really powerful. I think just as we're coming to the end, there's also a really interesting question on thinking about health benefits, not just in terms of economics. We've touched on economics and talked about the really vital importance of that, and sometimes how we need to fill some of the gaps about being able to put penny and pound on some of this. But also, are there any other measures and metrics that can be used or have been used really effectively that anybody wanted to touch on as we start to close the conversation?
I'll just quickly come in, so I didn't put my hand up. Yeah, I think metrics are really difficult. There was a happiness index at one point, talking of the mental health thing, and I'm not actually sure what happened to that, but I know that a lot of Scandinavian countries use this, so I'm sure one of our people will be there. But yeah, metrics are always difficult. How can you tell whether people are getting healthier? The only thing I would say is that we continue to live longer, so our lives are almost certainly a bit healthier. But what's that due to? So yeah, no, difficult thing, measurement of health.
Cvetina, our measurement expert, do comment, and then Neil after.
There are a lot of metrics, but from what I'm seeing, and especially in areas that cover so many different aspects and could cover, could cut across different policy areas, I think the danger is in getting overwhelmed by too many metrics and still not being able to answer the question. So I think the answer is having more, because it is ultimately, it is about changing behaviors. It is about changing attitudes. And some of the health benefits you might not be able to put a number on. So I think the right approach is to have a good mix between different methods. And it's not just, the answer is not in having only metrics, but in having a balanced approach, a social research approach, using behavioral science and using different types of quantitative and qualitative data over time to be able to show the benefits. And I think we have to be more focusing on contribution of different policies to the health outcomes or the benefits to the economy, etc., rather than attribution. In some cases, it's great, it's very powerful. If you have the resources, do it. But my message is you can still do a lot of other things in the meantime, and you can still be pragmatic if you get the right advice when you design your policies. Thank you.
Yes, completely. Thank you so much. And Neil, I'll let you have the very last word before we say goodbye.
Just to emphasise the point that Cvetina made there about the social science side of stuff, the real world stories of how these things are impacting people's lives, how they both are making them bad at the moment, and how when they're successful they make people's lives better. Those are the things that are really, really powerful. So as well as the metrics, it's really important we have this to accompany with it, to tell those stories that ultimately help to resonate with people emotionally.
Thank you so much. And thank you to Neil for starting us off with an overview of the research and bringing everybody together as one of the representatives from Imperial, and Polly and others behind the scenes, and to all three of our really great panelists, and for all of the questions we've had today as well. Thank you so much. It's been a really lovely discussion, and I've certainly come back with being reminded of some really great examples and learning a few other new ones too, which I will share with others. Thank you.
Thanks, everyone.
Thanks, everyone.